Hello guys, now I am going to tell you about the priority questions. So, priority questions are based on the information which we can get from the different kind of sources like priorities. The first one is ABC. The ABC priorities always goes to airway, breathing, and circulation. For example, you can see over here, use the ABC, airway, breathing, and circulation when selecting an answer or determining the order of priority. Remember the order of priority: airway, breathing, and circulation. Airway is always the first priority. Note that an exception occurs when cardiopulmonary resuscitation is performed. Means when you are getting like compression, means you are having a case in which you need the compression, means the heart rate is less than 60, 50, and you are going to give the compression to the person. Then after you will go first priority to the compression. Means like in the question someone is asking that what you will do if there is less than 60 heartbeat or less than 50. Then after you will not go to the ABC first airway, but you will follow the BLS, basic life support, ACLS, advanced cardiac life support. CAB you will follow. So CAB means compressions, airway, breathing, and the guidelines. All right. So for that one, in that case, means like you have four patients. First one is the hypertensive. Second one is the diabetic. Third one is the renal case, and the fourth one is the air blockage. What you will see, which patient you will see first. So first patient you can see at this in this situation will be air block, because in this situation you will follow the ABC. But in that situation where the compression is required, then after you will follow the CAB. Let's go to the Maslow's hierarchy of needs theory. And according to that, Maslow's hierarchy of needs theory, the physiologic needs are priority. So, what are the physiologic needs? The nutrition, okay, life, okay, saving the life, food, okay, contractions during the labor, okay. So, these are the physiologic needs, are the priority, followed by safety and security needs, love and belonging needs, self esteem needs, and finally, self actualization needs. Select the option or determine the order of priority by addressing physiological needs first. Let's go to the physiological needs. As I described, there is also a contraction. You can see the airway, respiratory effort, heart rate, rhythm, and strength of contraction, nutrition, elimination. These all are the physiologic needs. Let's go to the question about the Maslow's. So, the nurse planning care for a client experiencing dystocia determines that the priority is which action, position changes, and providing comfort measures. So, first of all, we have to see that what is dystocia. So, dystocia means difficult labor. While the pregnant woman is going for the labor, and there is a difficulty or obstruction, then after we will consider it in dystocia. So what is the priority in that case? Will you do the position changes in this case, and provide comfort measures? Yes, this is basic but not a priority. Explanation to the client about what is happening. So you are going to explain in that situation? No, the client will be in pain. All right. Monitoring for changes in the condition for the birthing parent and fetus. So you will monitor the changes in condition of the birthing. Yes, because we have to see that the contraction are more than normal, normal or less than that. What is the fetal heart rate? What is the fetal position? So all these things we have to monitor in that situation in which the labor is difficult. The fourth option is encouraging the use of breathing techniques learned in childbirth preparatory classes. So during while the woman was pregnant, the nurse gave her the childbirth preparatory classes, and you are going to encourage that you need to do the breathing technique exercises. So, is it necessary in this situation? No, because the monitoring for changes in condition of the birthing parent is most important over here. So, we will go with this one. Now you can see in the test taking strategy, not the strategic but priority, and use Maslow's hierarchy of needs theory to prioritize, remembering that physiologic needs come first. Yes, the nurse needs to have knowledge of the client's priority needs and generate solutions. All the options are correct and would be implemented during the care of a client with dystocia. Also note that the correct option is the only one that addresses both the birthing parent and the fetus. As I told you, the fetal position, fetal heart rate, and fetus, all over things about the fetus, and another about the parent, how the parent is feeling at that moment. Remember to use Maslow's hierarchy of needs theory to help prioritize and generate solutions. This is all about the priority questions. So in priority, we use priority or first when we are organizing a person about the situation, like who is going to be seen by a nurse or a doctor. So first is will be a strategic word in this situation. All right. So this is referred from the NCLEX RN ninth edition of the Saunders book. So and I have explained the one questions which is the priority based. So I hope you have understand, and this is the only for the understanding. Good luck for your exam. See you in the next question.